right, hello. Welcome to MEDabolic lectures. All right, guys, today's lecture basically we're going to be talking about right coronary artery, myocardial infarctions. Okay, a little tough subject for some students to understand, probably some patients too. But we're going to make it easy for you, okay, guys? Just make sure you like and subscribe, and let's get started. Now, when we talk about myocardial infarction, all right, essentially we're talking about what? A decrease in blood flow, right, through the coronary arteries. Now, the heart has many coronary arteries, and we know about them, and we're going to break it down right here. First things first, let's break down the ventricles and divide it into two. Here we have the right ventricle. Here we have the left ventricle. If you can imagine that, imagine the heart. The actual heart, of course, we know what it looks like. It's something along the lines of this that we've understood, and we have the AV node right here coming down at the Purkinje fibers. And here's the right ventricle, here's the left ventricle. Right ventricle, here's the left ventricle, here's the right atria, here's the left atria. And when we look at this up here, we got the SA node and we've got the AV node right here. So when we look at something like this, one thing we have to do is start to work towards from physiology into the pathology, into the pharmacology of the actual issue at hand. When we look at the right coronary artery, where exactly is the right coronary artery? When we look at the heart and we see this, we're going to see that the right coronary artery is right here. It's going to supply the back part of the ventricle a little bit, and then it's also going to loop around right here and start to supply a little bit of the inferior ventricular septum that we understand. Okay, along with that, when we look at this is, let's say, the right coronary artery. And now when we look at the left anterior descending, it's right down here. Okay, the left anterior descending we know is down there. We're gonna, let's just use this purple. It supplies the anterior part of the left ventricle here. And finally, we're gonna look at the left circumflex artery, and that supplies the lateral most side of the ventricle. Okay, now when we break it down, another thing you guys want to remember is exactly what happens when you get an infarction of the right coronary artery in association with its anatomical structures. So if we look at something here called the vagus nerve, it actually runs very close in proximity, okay, through the close to the interventricular septum and through the right coronary artery. So when there's infarction of the right coronary artery, it's actually going to irritate the vagus nerve. Here, we'll put the vagus right up here so we understand, right? And here's the little acetylcholine coming down and probably supplying these SA and AV nodes to lead us to certain cholinergic effects on the heart, which we know what happens when you have cholinergic effects on the heart, or acetylcholine increases for whatever reason, or you cause a vasovagal massage. Basically, it's supposed to help us increase the amount of acetylcholine that we release at that area. What's the effect of the increased acetylcholine? The effect of the increased acetylcholine brings us down to what? Bradycardia. Okay. And then along with that, you get what? All the dumbbells. You guys remember the mnemonics dumbbells. All right, here's DUMBELLS. Okay, you're gonna get diarrhea, urination. All right, you're gonna get meiosis, bradycardia, excitation of the muscles, lacrimation, and skeletal muscle excitation. This B right here is bradycardia. This is diarrhea, so you're gonna get the diarrhea a little bit too. And this is simply the reason why patients, the old people who get a right coronary artery myocardial infarction, they do get diarrhea when they have a heart attack in the right coronary artery. They do get bradycardia, and along with that, they do get lightheaded because, again, you get cholinergic stimulation. All right, this is lightheadedness. We're just going to call it here. Now that happens. Now, what do we do? When you have something like this going on and you have infarction of the right coronary artery right here, which is totally impeding blood flow into interventricular septum and back here, not only are you getting these symptoms, your left ventricle, for the most part, has now stopped pumping too. If it's not pumping forward, blood is building up. If it's building up in both the right and the left, what do you get? JVD, jugular venous distension. This is another key feature of right coronary artery. What else you get? If it's not pumping forward, what do you get? Hypotension, drop in blood pressure. And when we look at our treatment and the mainstay of treatment, it's going to address these issues. We're going to deal with the hypotension. We're going to deal with the bradycardia. We're going to deal with the pain, obviously. So remember, back here, the right coronary artery actually supplies a third of the interventricular septum. All right, so even though it's pumping forward, it's not doing its job properly. It's kind of sluggish. Okay, so what do we do? Essentially, well, okay, if he's got hypotension, what do we do? Fluids. If you don't got tension, we give you tension with some fluids. So normal saline works perfect right here. So we start IV fluids right away. And then what do we do down here? How do we address the issue of vagal stimulation right here? Well, how about we give the patient atropine? Who remembers the mechanism of action of atropine? Great. Good job. That's all of you. So atropine is an anticholinergic. It's going to block acetylcholine, which is exactly what we need to block the effects of this right here. So when we look at right heart failure, let's give a quick summary. Right heart failure, myocardial infarction. Here's the left ventricle. Right coronary artery supplies the top third or the back third of the left ventricle, along with supplying the back of the left ventricle and supplying basically all of the right ventricle. When you get infarction of it's not pumping forward, you get JVD. Infarction of the right coronary artery also irritates the vagus nerve, so you get increased acetylcholine and you get symptoms of dumbbells. So you get bradycardia, decreased heart rate. Dumbbells, obviously, because you're going to irritate the vagus nerve, along with that lightheadedness. How do we treat them? Fluids, fluids, fluids. How do we treat them? Fluids. Okay, we have to remember that the main treatment for right coronary artery myocardial infarction on the boards, USMLE step 1 and 2 and 3, is fluids and atropine. And that right there is right heart failure.